We're heading down the home stretch. We're almost there. Our $20 million state-of-the-art health center and teaching institute is 85% completed.
This home stretch is our responsibility. We have wonderful people who have laid the foundation for us, but I cannot stress how much this is a community effort and how much these gifts are for all of us. So as mayor of just one of the 3 communities that have significant impact by CHC, and also knowing that this is a regional effort as our families and our residents move from community to community and we share many things regionally, the health of the community, the health of the individuals in our communities is so critically important.
Today, operations have expanded to meet the demand with 3 health centers strategically located in Gardner, Leominster, and here in Fitchburg, as well as an Action mobile van, which goes out to provide medical services. Patients travel from over 19 communities to receive comprehensive medical, behavioral health, and dental services. We currently serve over 24,000 patients a year, with 115,000 visits annually, and we've grown to employ over 275 people in this region.
This campaign is all about building excellent health care for everyone in North Central Massachusetts. Our goal is to raise $3.5 million to complete this beautiful, beautiful building.
And I know from experience from all the projects that I've seen, the money sometimes is raised from little kids coming in with their money jar from their little bank that they saved money, or somebody that collected cans. But all of those pennies turn to, you know the whole thing, and then it turns into millions of dollars, and then we complete the project. Let me just say, a lot of work to get to a facility like this. You know, this is a dream, but a dream built on reality, because the reality is, I don't think anybody even suspected how much need there was in this area.
Right now in Fitchburg, the CHC serves 20% of the population in the city, and I know we need more. I cannot imagine life in Fitchburg and the Fitchburg area without CHC and the services that they provide.
Also unique to Community Health Connections is its commitment to teaching. CHC is one of 4 teaching centers in Massachusetts. In partnership with UMass Medical School, we are currently training 19 family medicine residents.
More importantly, and I think the vision of my father was the teaching of young family doctors, and we all know that going forward, primary care physicians are becoming fewer and fewer and fewer. And the hope with our family practice residency program, which has been getting stronger and stronger and stronger every year, will attract the brightest of the brightest once they see this institution.
I also want to address UMass Medical School. We have a great residency program here, and certainly having a facility like this is going to help us compete for the best and the brightest. And as we know, I think less doctors are choosing general practice, so we have to be more competitive, and we have to have a facility like this in order to compete for the best doctors and the best healthcare here.
And we've been lucky over the years that a pretty high percentage of them end up, after graduating here, staying in the local community and practicing. I can think of physicians in Townsend and Ashburnham and Westminster and Gardner and Fitchburg and Leominster, younger doctors that are staying here and taking care of all of you.
Additionally, as we'll hear from Dr. Esquino, we partner with Mount Wachusett Community College. We have a dental hygienist and a dental assistant training program.
We have 40 students here, and we have 7 faculty members here at this facility. We hope to add to that program, so we'll have about almost 50 students here and perhaps 8 faculty and staff here at this campus.
Dental hygiene and dental assisting students, these programs from Mount Wachusett Community College. This is an underserved area that very few people had access to before, but significantly impacts the health of individuals. So to be able to forge this partnership with Mount Wachusett Community College and expand this program here is going to significantly help the citizens and also our youth.
We started that program because a number of dentists in the community came to us and said, we need dental hygienists. We can't find dental hygienists. We can't hire dental hygienists. So we said, okay, we'll put together a program. And we came together with the Community Health Center and with a number of dentists in the area who actually taxed themselves, and the program is in existence now. And what is important about those programs, that program, is the students reside, for the most part, within North Central Massachusetts. When they leave the program, they will be hired in North Central Massachusetts, and my hope is they'll be contributing to the civic advancement of the community. So this is a very important facility, and I would encourage all of you to get involved in the campaign.
And the CHC campaign is instrumental to the future of not only CHC, but to the future health of everyone in this region. And as I reflect on partnerships, I think immediately of the Health Alliance partnership and the UMass partnership with CHC. Although we are separate organizations, Health Alliance, UMass, and CHC have been not only partners, but teammates for many, many years. Our health system and our entire community benefit because CHC not only exists, but provides exceptional and convenient care to everyone in the community.
But a healthy community needs to be more than civically engaged, it has to be physically engaged. And that's what this facility is all about. Unless one is healthy and can satisfy those basic physiological needs, one never gets to contributing to community, being civically engaged, caring for neighbors. And that's what this facility does, perhaps more than all others, because it takes care of those who cannot afford to take care of themselves or their families. This is very important.
Haywood Health System, a new system, the alliance between Athol and Haywood, and it's about the region, this particular region, delivering quality health care here. And we could not do it without the CHC partnership. Absolutely could not happen. 40,000 people, those underserved, underinsured people that CHC plays such an important role in.
And at Health Alliance, we believe in our tagline, exceptional care for everyone. And Health Alliance is grateful and honored to be a true, trusted, loyal partner and teammate with CHC, with your leadership, with your physicians, and with all of your employees. I know that together we will continue to provide exceptional care for everybody right here in North Central Massachusetts.
And probably most importantly, the role that CHC is playing in this region right now is their commitment to behavioral health services. It's one that Haywood takes on very, very seriously. It's one that's very easy to turn your back on. It doesn't pay a lot of money, but it's something that Haywood Hospital, Athol Hospital, and CHC are very, very, very committed to. And as those of us that live in this world understand, there is a huge need and maybe even a growing need in that area.
So the Community Health Center is right now, looks like a beautiful facility that you can walk into. You can get great medical care, primary care service, dental care services. But this is also an organization who has reached or is challenging themselves to reach into our community and really help those who are in need. So I want to thank all of you for doing that. For building these beautiful facilities in Fitchburg, Leominster, and Gardner, but also for making sure that you have the mobile facilities, you have the action centers, and you want to make sure that we serve every person that lives in our community. So I want to thank you for that.
I am the worst person in the world to ask people for money, and why I said yes to Arlene to be part of this campaign was because this center cannot fail.